The counties are now seemingly the new COVID-19 frontiers. NTV's Charity Mwangi highlights the increase in the number of counties designated as higher risk locations for the spread of the virus as the country continues to record a sharp rise in hospitalizations and new infections.
The Reuben Cheruiyot High School fraternity is still coming to grips with the death of their teacher, Leah Chelagat Kulei, who is said to have succumbed to COVID-19. According to her colleagues, the county and national government failed to protect her and other teachers who resumed duty barely a month ago.
How many teachers should lose their lives? How many teachers should be confirmed coronavirus positive so that the government can rise up?
The teacher's death made the shortcomings of the country's healthcare systems even more vivid. According to a recent report by the Kenya Medical Practitioners and Dentists Council, many of the counties are yet to meet the 300 isolation bed capacity set by government. Some ICU facilities don't even have human resources to man them.
We are worried a lot, and we want to say that we are living by the mercies of God.
Since schools opened, no testing has been done in the schools. No provision of the PPEs apart from the only sanitizer to the teacher.
As the president of this country, consider closing down schools up until the schools are ready to accommodate the teachers, the students, and other staff.
In Nakuru County, the governor admits the beds are few and far between. Even as the virus continues to infiltrate the community's relaxed defenses.
Over 80% of our beds are already occupied by COVID-sick patients. In the private hospitals, ambazo ziko hapa, hata kama uko na pesa, they will not be able to accept you kwa sababu the beds set aside for COVID are already full.
As you know very well, the few private sector hospitals that we have are already stretched out. It is not an indication that the country's health facilities are stretched out. It is an indication that the faith that we have in our own government sector is wanting.
But with a number of hospitals now gasping for air, Acting Director General of Health Services in the Ministry of Health says it's not yet time to hit the panic button.
For example, one of our premier institutions, Kenyatta Teaching, Referral and Research Hospital, has a capacity of about 350 beds. As of today, we only had 35 patients. That's about 10% occupancy rate.
In Kakamega, the county chief of staff, Robert Sumbi, succumbed to COVID-19 shortly after the county ordered a mass testing of all county employees following a surge in infections at the county. He is one of the senior county executive and assembly staffers who have contracted the virus lately. Charity Mwangi, NTV.